Okay. Welcome everyone to the second day of our journalist workshop. And I would like to just first give some opening remarks. And then after that, we get on to our first session for today. So way back in January 2018, I was actually invited to CSE workshop in India called the Africa Asia Workshop on Implementation of National Action Plans on Antimicrobial Resistance. We're actually focusing on animal and environmental aspects of AMR. This was an intensive 3-day workshop, and we learned a lot from that particular workshop, including overview of our AMR national action plans from both African countries and also Asian countries, the challenges we are facing, and including raising awareness, how we are going to do that in our countries, surveillance in the food, animals, and the environment, antimicrobial use, how to raise funding for our national action plans, and also even costing of our national action plans. So we really actually learned a lot at this particular intensive 3-day workshop. One of my memories is that when we went to CSE, they have their own hotel at the campus. I think we're the first pioneers to sleep in that complex. And then we had at least so much carried food from breakfast, lunch, and supper. So, and also went to an Indian castle. So the rest are just good memories. And then after that, I was once again invited at the beginning of 2019 to attend a meeting in Zambia, which they had organized with the Zambian National Public Health Institute, since they were working in collaboration with them. And the person who actually inaugurated this particular workshop was their Minister of Health, Dr. Chitalu Chulifa, including many other dignitaries, and also including the Indian High Commissioner to Zambia. So, and there were more than about 10 different African countries also present. And then CSE is actually developed together with the Zambian National Public Health Institute, a number of documents that they actually developed, and such as prioritization of their national action plans, framework for integrated AMR surveillance, baseline information for AMR surveillance, and roadmap to phase out non-therapeutic use and critically important antibiotics in food animals. And I remember at SAPA, Amit Kurana actually indicated to me that they also wanted to work with one more other African countries. And then I'm glad that at least I managed to convince him to work with us, Zimbabwe. So here we are now, at least having our first workshop. And then at the same time, we are also already started working together by having this awareness workshop for journalists, because we don't want to always be waiting for the World Awareness Week that actually takes place once a year in November. We'd like our journalists to continuously report an AMR, throughout the year, so that at least it's not forgotten in between and only remembered during the World Awareness Week. So we are actually happy that we are actually holding this particular workshop, whilst also in the background, we are having an MOU being signed by our ministers. We are also having an MOU being signed by our ministers, so that we can actually do collaboration that is actually known by both countries. So yesterday we went through, we had a lot of encouraging opening key people that actually talked to us when they opened this particular workshop. Supano, Dr. Nika, Mr. Kujingani Lokadia Mavudzi. And then after that, of course, we had the global aspect that was actually being shared by our all-weather partners, WHO, OIE, and FAO, which actually gave us a global outlook concerning issues on AMR, globally, regionally, and even locally, what they've done here in Zimbabwe. Without this tripartite in Zimbabwe, we could have been struggling really, and we are really thankful for their undivided support from the beginning. And then we also had from 3 journalists what progress and challenges that they have actually faced concerning reporting. So today, we're going to be hearing from key people in the human health, animal health, and the environment on what Zimbabwe has done concerning AMR in order to contain it. So I'm not sure whether now we have Dr. Manangazira on, if she's now on the panelists as participants, so that you can just go over to her presentation, and then she'll give us on what the human health is done concerning issues on AMR. Dr. Manangazira, are you there yet?
So I don't think she has been able to join Dr. Sekisai.
Okay. So whilst we wait for her to join, we'll actually go to our next person on the agenda. It's from animal health and food and animal health production. That's Dr. Kenan Tinashe Odobo. He's the AMR focal point for animal health, and he works in the Central Veterinary Laboratory in Zimbabwe. So Dr. Odobo, can you give us the issues concerning animal health and food animal production here in Zimbabwe?
Thank you, Dr. Zinyowera. Let me give the animal health perspective concerning the topic of antimicrobial resistance here in Zimbabwe. I hope you can all see the presentation that I have projected. AMR containment in Zimbabwe. Okay. What I can say from the animal health perspective.
I'm sorry, I think you're muted. Sorry. Okay. Thank you.
Hello?
Thank you very much. Thank you, Mr. Amara. We have not seen that. We have not seen.
Hello?
You can continue.
Okay, thank you. From the animal health perspective, what has been the guiding concept of our efforts to contain antimicrobial resistance in Zimbabwe has been the One Health approach. I think this is a term that is well known and has been spoken of many times. And it's not an exception in Zimbabwe. So we've been using this kind of approach. And just to give a pictorial representation and depiction of that, we have an appreciation that the livestock sector is very much important. That is the domestic animals and the companion animals also, and families and households, the food and agriculture sector, and also wildlife. So in this picture, I just tried to put and summarize everything in one simple picture, and the environment within which all these specific players are found. Now, our One Health approach is multi-sectorial in nature, and also we are working together with the environment, human health, and also recently, I think we have to admit that in the past, plant health was not well considered, but now I think even when we consider the AMR surveillance strategy that we have drafted, we have included a lot of aspects on plant health. So the Ministries of Environment and Health and our Ministry of Agriculture, they are all in collaboration in the fight against antimicrobial resistance and coming up with solutions in terms of how we can use antimicrobials in a more prudent manner. I'm sure in the presentations that were given yesterday, people gave an idea, and I remember the other speakers that presented yesterday talked about what the resistance is all about. So this slide just shows and also emphasizes the same points that were highlighted, that from number one here, we do have the use, antimicrobial use, where we have the antimicrobials, and that are responsible for applying selection pressure on bacteria, and then you end up through various mechanisms having some superbugs being produced, and they cause problems to the various sectors: the animal health, human health, plant health, and also the environment. So to put things into perspective and our involvement from the animal health sector within the country, we derive most of the activities that we are doing today from the 2015 WHO Global Action Plan on Antimicrobial Resistance, which was a concerted effort by WHO, OI, and FAO. In 2016, we had the situation analysis, and there was a heavy contribution by key participants within the animal health sector in trying to come up with a good assessment of the situation of antimicrobial resistance or antimicrobial use within the country and within the animal health sector in the various value chains. We were part of the launch because we are multi-sectorial partners of the AMR National Action Plan that we had in 2017. So this was also another step in our efforts, even from the animal health side, in the fight against antimicrobial resistance within our own context. And in the same year, in 2017, we had other activities that were very important that started, like the WHO AGISA, which was an integrated surveillance project, a pilot project that involved the Ministry of Health and Child Care, and also the colleagues from the environment, and ourselves from agriculture, mainly the animal health sector. So when we are doing some preliminary pilot surveillance work, and this continued into 2018 and 2019, and I'm sure the findings were shared in some of the presentations, and they're going to be packaged into a publication that will be shared to everyone. The overall goal, as we contribute to the efforts for fighting for antimicrobial resistance, is housed within the National Action Plan with our 5 strategic objectives, where we targeted that by 2022 would have made some progress, major progress in the fight. Just to share some of the things that have been happening in the animal health sector in terms of awareness, we've been making some efforts, including, if you look here, for example, this is a Sunday Mail, a newspaper publication where we had articles being written in those publications on the topic of antimicrobial resistance, like this one on making sense of AMR in agriculture. This was an effort to try to increase public understanding of the problem. And you can see several other efforts from the animal health sector of people that are focusing on specific issues, some to do with the public health implications of antimicrobial resistance, with isolation and profiling of enteric bacteria isolated from food products. So from the public health perspective, that was something that some of the researchers in the animal health sector felt was very important, and it's part of the effort that has been made from, I know that there are a lot of people that have been publishing from 2017, 2018, 2019, and there are also some recent publications, 2018. And also this is in 2020, I mean, this is contributing to the literature that is available, because this was one area that was lagging behind on the topic of antimicrobial resistance within the country, and also shedding some light of the perspectives within the animal health sector. This slide shows further awareness efforts within the One Health context, because when you look at this particular picture here, we have Mr. Kujinga, Dr. Manangazira from the Ministry of Health and Child Care, and you do have Dr. Lawrence Dinkinya from the animal health sector, and Mr. Mbambi from the environment. So this was a public lecture at the Harare City Library, and it was meant to raise public understanding of the problem of antimicrobial resistance. So this was the animal health perspective also was well represented there. And you can see several pamphlets that are also in this slide. These are pamphlets that were created and translated to local languages so that we could also rope in the general public in the increasing awareness on the subject of antimicrobial resistance and its importance. So some of the efforts that have also been made is to assess our national antimicrobial resistance surveillance system in the food and agriculture sectors in Zimbabwe. In this respect, we got support from the Food and Agriculture Organization, and we had what we called Atlas missions. We had 2 missions, one in 2017 and we had another one in 2019. So this was an effort aimed at getting an understanding of the capacities that are available and the gaps and where we need to put more effort in terms of fighting antimicrobial resistance within the food and agriculture sector. Of course, with linkages and collaboration with the other sectors, the environment and the human health sector. And we also had some studies, some CAP studies that looked at that focused at the poultry value chain, aimed at getting an understanding of the context of antimicrobial use and antimicrobial resistance in the poultry value chain. And a local publication was made, and this was sponsored by the Food and Agriculture Organization. And from those studies that we're doing at country level, they were consolidated together by 5 different countries that were beneficiaries of the Fleming Fund to come up with a more regional perspective on the drivers for antimicrobial use and resistance. We have ongoing collaboration on antimicrobial resistance, on metagenomics, and again in the poultry value chain. So we have the FAO and the Department of Veterinary Services working together with the Technical University of Denmark, DTU, in this respect. Another point to note is that there's been some efforts. Again, I think the support that we got as a country and also in the animal health sector was coming from the Food and Agriculture Organization of the United Nations, an effort to look at the existing legislation that we have in the country on antimicrobial resistance to see the robustness of the existing legislation and its relevance in terms of how it can contribute to the containment of the problem of antimicrobial resistance. So these are some of the things in summary that have been happening within the animal health sector. And of course, like I mentioned, almost everything that I've mentioned has been in collaboration with the colleagues that are in the other sectors, the human health sector, the environment, and the food and agriculture in general. So I would like to thank the Ministry of Health and Childcare, the National Association of Freelance Journalists, the Center for Science and Environment, the Government of Zimbabwe for jointly organizing this event. And I also have some gratitude for the Department of Veterinary Services, OIE, FAO, and WHO. Thank you for listening.
Thank you so much, Dr. Odobo. I don't know whether Dr. Manangazira is yet on. If he's not, then we'll listen to, is Dr. Manangazira in now?
Well, if she's moderator. My apologies, I was struggling to get in, but I'm in now.
That's great. So your presentation will actually go up just now. We'd just like to thank you. Yes, we'd just like to thank Dr. Odobo on what he has highlighted on how much we have really worked together as One Health. And he has also indicated the many publications that the Ministry of Agriculture has actually done, the awareness campaigns we've done together, metagenomics work that they do with DTU, even the legislation that we are actually assisted by FAO. So now over to you, Dr. Manangazira, so that you can give us the human health aspect concerning AMR, the things that have been happening within the human health. Thank you. Over to you, Dr. Manangazira.
Thank you, Dr. Zinyowera. May I have my presentation? I shared it earlier. I can't screen share on this gadget that I'm using. Thank you. So I'll make this presentation on behalf of the Zimbabwe team. And so I acknowledge, the host has asked you to start your video. Okay. So I acknowledge the support from all the AMR partnership within the country. Since this is a media workshop, I'll start with the highlights of our launch of our situation report, a report of the situation analysis that was conducted in the country as regards antimicrobial resistance, as well as the national action plan that was developed. These two documents were jointly launched in September of 2018. And they paved way to some of the work that we have managed to do so far in terms of addressing the challenge and burden of antimicrobial resistance in the country, and also served as a platform where the One Health family and fraternity can contribute their individual and joint efforts towards addressing the burden of antimicrobial resistance in the country. Can I have the next slide? Okay, so on the first slide, it just shows the tripartite arrangement within government. The chief director then for veterinary services, the minister represented by Deputy Minister of Health, and then the then Minister of Water, Environment and Climate, as well as the three agencies, the World Health Organization, OIE, and Food and Agricultural Organization. So that slide just shows additional pictures in terms of the launch event, but also the pictures showing the two documents that I talked about, our National Action Plan to address antimicrobial resistance, as well as a report of the situation analysis and findings. Thank you. Next slide.
Yes, we were going to provide.
So just highlights from the antimicrobial resistance situation analysis, looked at the human resources for health in Zimbabwe, in total, not just specific for antimicrobial resistance, and found out that during the first 10 years after independence, Zimbabwe had indeed made great improvements in the health sector. Thereafter, there had been decline in health indicators due to brain drain of skilled, experienced health workers, resulting in poor conditions of services, including low salaries, difficult access to basic and medical supplies, and impacting on the care of persons, particularly those affected by HIV/AIDS, TB pandemic. There was also, in terms of the supportive environment for delivering health services, poor water and sanitation, and this led to high levels of infectious and epidemic-prone diseases. Next slide. So in terms of the findings of the human public health sector, remember we're doing this work in 2015 when we started the AMR work in the country. We found that there were a lot of vacancies across the key staff cadres, with 64% only of doctors in post, 89% of nurses in post, and 65% of pharmacists. Across the board, the vacancy levels were quite significant, and of course that impacts negatively on health service delivery. Next slide. So that also was the situation regarding technical staff at the Central Veterinary Laboratory and the provincial labs. And this, they gave us information as at December 2014. So in terms of the veterinary research officers, the staffing levels as percent of establishment was at 39%, with technologists at 64% and technicians at 57%. Next slide. So in summary, in terms of the staff establishments in both animal and human sectors, there were significant shortages. Medical staff such as doctors and vets are supposed to be the main prescribers of antimicrobials, and this resulted in the finding of anybody just prescribing and accessing antibiotics, and it was really because of the shortages of staff that is supposed to do the actual prescribing. So when it comes to the findings concerning surveillance, we found that there is a strong and effective surveillance program in place for notifiable conditions. The lab-based surveillance system had been ineffective for a long period due to lack of specialist professional staff, equipment and reagents, and only 27% of the public health labs for humans had the capacity to do culture and sensitivity testing. So that really greatly limited the AMR capacity. Next slide. The Central Veterinary Lab with 3 other provincial labs and some small microbiology labs at abattoirs and slaughterhouses are the ones testing animals and animal products for residues and microorganisms in the whole country. When a farmer is unable to pay for lab tests, the specimen is not processed. And then samples that do not meet lab requirements, and that limits information for surveillance to only those that can afford to start and follow through with the tests and test results. The capacity to carry out antimicrobial residue testing was available at the Central Veterinary Lab, in the toxicology lab, but only few tests were happening during that time of the survey. The Government Analyst Lab within the Ministry of Health and Childcare carries out tests of processed foods from samples sent from across the whole country, but they too had limitations in terms of accessing adequate reagents, resulting in some of the processes, the specimens going unprocessed. The Environmental Management Agency carries out chemical and lab and microbiology tests on potable, raw and waste waters, but there were no antibiotic sensitivity tests being done during the time of that survey. Next slide. So in terms of the WHO AGISA surveillance, this looked at the 3 central laboratories that I talked about, looking at specimens from food animals, food humans, and the environment. The primary source being 2 abattoirs, 3 provincial. We have 8 provinces, so 3 of them were participating and 1 private laboratory. Those were shipping specimens to the Central Veterinary Lab. And then the food was being sourced from supermarkets and informal traders and going to the Government Analyst Lab. And then within the human health sector, 7 government hospital labs, 1 city health and 3 private laboratories were participating and sending their specimens to the National Microbiology Reference Laboratory. And then from the Environmental Management Agency and the Harare City were shipping specimens to the National Microbiology Reference Lab. We have the Medicines Control Authority as a regulator for antimicrobial use for both humans and animals, and they regulate medicines for both humans and animals. And the Directorate of Pharmacy Services looking at antimicrobial use in humans, and all of that coming to the National Coordinating Center. So that has been the arrangement for our surveillance. Next slide, please. So in terms of some of the findings, I'll just highlight on the next 3 or 4 slides, the findings in terms of E. coli, the sensitivity from avian samples. There has been significant antimicrobial resistance there across the cotrimoxazole, ciprofloxacillin, ampicillin, ceftriaxone, cefepime, and quite significant resistance to tetracycline, as shown on the graph. Next slide. And then from the bovine samples, again looking at Escherichia coli, quite significant resistance to cotrimoxazole and tetracycline, with sensitivity still to the other antibiotics, including ampicillin. Next slide. And then from the chicken cats, almost similar, but very high resistance there to tetracycline. Also significant resistance to cotrimoxazole with sensitivity to the newer cephalosporins. Next slide. And from the environmental samples, we do have similar pattern, but surprisingly, sensitivity is quite high for cotrimoxazole. Next slide. So when we look at antimicrobial use import results for the years 2017 and 2018 for human consumption, the top 10 imports for human antimicrobial use in kilograms, we see in 2017 azithromycin coming on board, limited imports of penicillins, erythromycin, and metronidazole, and cefuroxime. And some of the, I think we have to interpret some of these results with caution because of the challenges that we have had in terms of procurements, but also sourcing the foreign currency. However, in terms of going forward, we then need to go in depth into analyzing and just making sure that we understand the meaning of these import figures, especially as they relate to the antimicrobial use on the ground. Next slide. So again, this is a table just detailing the antimicrobial use import results for 2017, 2018, but now looking at animal consumption. Next slide. So in terms of the main outcomes, we find that concerning human samples, ampicillin showed the highest resistance of 70% and above in all the 3 types of samples, in the blood, in the urine, and stool samples. The avian samples, whether cloacal, cecum, or food samples, showed highest resistance to tetracycline as compared to the bovine samples. The E. coli isolated from environmental samples showed high resistance to ampicillin of 51.6%. And then of the top 10 import medicines in 2017 and 18, cotrimoxazole, amoxicillin, ciprofloxacillin, metronidazole were among the most imported medicines, with cephalosporins not commonly used in the public sector, but in the private sector. And then tetracycline, which is the most imported medicine at 46%, was being used in all species of animals, whether food producing, companion, or terrestrial aquatic. Next slide. So now coming to some of the support that has come in, we do have support coming in from the Fleming Fund across surveillance, but also AMR capacity building and governance. And there's 14 sites that are going to be supported. So we just highlighted this slide so that in the next engagements and meetings, but also indeed in terms of communication to professionals and the public, we can now start looking at tracking progress, starting with the facilities that now have comprehensive support. In terms of the National Microbiology Reference Lab, which is really at the apex of the lab system in the country, we have 2 central hospitals in terms of Harare Central and Pararenyatwa Central Hospital. We also have the City Health Department running 2 infectious diseases hospitals in Harare, but Beatrice Road is one out of those 2 hospitals coming on board. Then Mutare Provincial Hospital, Laboratory, Mashingo. Mpilo is another central hospital, but the provincial, the lab coming on board. And then the Central Veterinary Laboratory, the Animal Science Laboratory situated in the Faculty of Veterinary Services at the University of Zimbabwe. And then the Mutare Provincial Veterinary Laboratory, Mashingo and Bulawayo. We have 1 Environmental Management Agency lab in Harare also coming on board, as well as the Government Analyst Laboratory. Next slide. And we also, among the support coming from Fleming Fund, are going to be looking at various fellowships, and they will now, even as they advance professionally, also look at aspects of implementation of our National Action Plan, but also go into the findings from the situation analysis, so that as a country, we emerge out of that funding phase having addressed most of the issues that were raised during that survey and situation analysis. Next slide. So I think that should have belonged to my earlier submission on the resistance findings. My apologies for the order. Let's move to the next slide. Okay, so as a country, we do have quite a lot of challenges of antimicrobial resistance. We just highlighted here cholera, but we have seen typhoid resistance. And during the COVID-19 outbreak, we also realized that some of the issues of antimicrobial resistance still come to haunt us in terms of complicating cases. So here we just highlight in the next few slides the cholera resistance. As a country, we have experienced quite a number of cholera outbreaks, but of note is the last outbreak where the resistance really was characterized and backed by evidence. So we saw complications among the cholera cases that would normally just improve on adequate rehydration, and the resistance was characterized in terms of ciprofloxacillin, among other common antibiotics. And this actually assisted us to argue in favor of a vaccine for the cholera. And I'm sure we will then be using vaccines to try and save or gain back on the use of some of the antibiotics that we have lost, including in fighting outbreaks of typhoid in the country. We have seen quite high levels of resistance. Next slide. So I think this just buttresses the issue of our documented resistance to antibiotics against cholera during the previous outbreak. Next slide. So the impact of drug-resistant cholera was really, we saw a lot of severe cases. It was much less cases than the previous outbreaks, but there was severity because of the resistance to the commonly used antibiotics. But it also meant that we had to deploy much more resources to treat those patients. They will stay longer in the cholera treatment facilities, require more staff. The cost of antibiotics rises exponentially once you go past the first line, and we also saw that during that last cholera outbreak. And in some instances, third line antibiotics yet to be used, including azithromycin. Next slide. So that just talks more to the escalating costs as you move from the first line to the second line and to the third line. Next slide. So what is it that we can do to avoid the high costs, but also the high levels of loss of life? There's an urgent need to preserve the remaining antibiotics so that they continue being effective against pathogens. And then in response to the threat of antimicrobial resistance, the government of Zimbabwe has set up the National Antimicrobial Resistance Program that is working to combat the antimicrobial resistance. And as I said, at least now with improved funding as compared to when we started way back in 2015, we can really look forward to much more improvements in terms of the country coming together as one health and addressing the antimicrobial resistance. And of course, this requires a whole of society approach where every citizen has a role to play. We have people peddling drugs on the streets. We have people running mini hospitals or clinics within their homes. We have people selling and importing antimicrobials. And we really need a whole of society approach, including communities, the farmers, the health workers, and also the media to work in favor and spread the message so that we fill the information gaps that we currently see and move towards the rational use of antimicrobials. Next slide. So the human, animal, and environmental sectors have been able to work together in a one health approach, and I'm happy my colleague Godobo also highlighted that in his presentation. We now also need to move towards a one health approach for the data collection and information sharing platform. So we need to establish that, or to strengthen what is existing. We do report here and there jointly, but we now need that for the AMR. There is need for stewardship programs to be implemented in all sectors in order to prevent antimicrobial resistance. Next slide. So I'll end there, and thank you very much for the time and for this opportunity to discuss antimicrobial resistance and inform media and see how best we can work better with media for more knowledge and preservation of the antimicrobials that we have. Thank you. Over to you, Madam Moderator.
Okay, thank you very much, Dr. Manangazira, for highlighting to us issues concerning when we launched our antimicrobial resistance national action plan and situation analysis, the HR issues within our ministries, some of the projects we have actually done, and also how we have even experienced these issues face-to-face concerning antimicrobial resistance when we experienced that cholera outbreak. So thank you very much for really highlighting all those things that we are living already, you know, where there's resistance. Of course, there was somebody who wrote a question on the chat saying that please, I think this person must be a journalist, her name is Farai, or he, because she was saying that there needs for further explanation for these technical terms in simple terms. So at least these are some of the things we'll need to do to our journalists, you know, to be so that they really understand what we want to say and that they convey the correct message to the people. So I think we'll have, after Tracy has spoken, then people please take note of your questions, and then we, all the three people, panelists, can now be asked these particular questions. So over to you, Tracy Mbambi. He's from the Ministry of, from Environmental Management Agency in Zimbabwe. So she'll talk about what the environment has done concerning combating antimicrobial resistance here in Zimbabwe. So over to you, Tracy.
Okay, thank you so much, Dr. Zinyoera. I think I'll need my presentation up so that I start presenting. Okay, I'm going to be talking about AMR containment in the environment. So basically my presentation will be looking at just a brief overview, the introduction, the role of AMR, drivers of waste in the environment, impacts of poor waste management, then the major highlight of the presentation, strategies to combat AMR in Zimbabwe, then obviously challenges that we are facing in trying to combat AMR, and then finally the conclusion. Next slide, please. Okay, so I'll start by way of introducing my presentation. Antimicrobial resistance is recognized as one of the most important global issues for human and animal health in terms of societal impact. However, one of the key gaps in understanding AMR is the role of the environment in antimicrobial resistance. Because what has been happening in the past is we've been focusing on what is going into the environment in terms of what is the waste that is going into the environment and not what is coming out of the environment. So there's need for us to rethink and to reprioritize so that we see the environment as really the source of what is coming back to haunt us, should I say. Next slide. So to achieve this, there is need to adopt an AMR-centric approach to waste management. This approach will control the dissemination of AMR determinants into the larger environment, which sets resistance growing like a chain reaction. So really in Zimbabwe, I'm going to look at who is looking at issues to do with waste management. Next slide. So in Zimbabwe, the Environmental Management Agency, a statutory body established under Section 9 of the Environmental Management Act, Chapter 2027 of 2002, is the one that is mandated to regulate, to monitor the collection, disposal, treatment, and recycling of waste. So we have waste management laws that govern the transportation, treatment, storage, and disposal of all types of waste. Next slide. So what are the drivers of waste, especially looking at Zimbabwe? The major driver of waste in Zimbabwe are the high population densities. If we were to look at statistics, you'll see that in 2002, 40% of the population was living in urban areas as compared to 22% in 1982. So you can imagine where we are at right now. If 40% of the population was living in urban areas in 2002, in 2020, I bet we are now at 80 to 90% of the population in the urban areas. So this is leading to sprouting of illegal settlements as people try to look for accommodation and places to stay as they come into the urban areas. The other driver is the changing consumption patterns. Then also we look at the issue of non-provisions of bins and also the inconsistent collection of bins by local authorities. The other major issue is really people's general attitude towards waste management. You see that not many people would want to look at, sorry, I'm still on the, okay. So not many people are really concerned with waste management issues. Some people just want to dispose of their waste at a certain place where they know that it's not allowed, rather than wait for the local authorities to collect the waste. So an estimated 1.6 million tons of waste are generated in Zimbabwe annually. And this figure is expected to surpass 5 million tons per year by 2030 if no action is taken. Next slide. So the impacts of poor waste management, the major impact would be pollution of surface and groundwater. This leads to recurrence of diseases such as cholera, typhoid, and dysentery. And when this has happened, people are exposed to many antibiotic treatments And the more antibiotic treatments people have, the greater the risk of developing bacterial resistance. This, a case in point would be the cholera outbreak that Dr. Manangazira was talking about, that was experienced in 2018. So really, you'd see that the environment really has a part to play when it comes to antimicrobial resistance, because we're looking at issues to do with water supply, good water supplies. We're looking at issues to do with sanitation. So really, the environment has a major role to play. We also look at loss of aesthetic value of land. Next slide. So here I just have a picture of improperly disposed hazardous medical waste. This was at the backyard of one of our hospitals in Zimbabwe. Next slide. Okay, so what is the environment doing to contain AMR? So we have different strategies that are being put into place by the Environmental Management Agency in an effort to contain AMR in the environment. I'd say the major issue that we should talk about is the commitment to the One Health that was shown by the signing of the National Action Plan by the then Minister of Environment, Tourism and Hospitality Industries. This was in 2017. Next slide. One other way that the environment is using to try and combat AMR in the environment is through surveillance. So we have one major project that is being done by the Environmental Management Agency. This is a project that we've started, that was started this year, that is 2020. In this project, there is really, we're trying to establish monitoring points for AMR nationwide. These points are going to be points that go along with our usual ambient monitoring points that we have in the country, because the Environmental Management Agency monitors the river waters on a monthly basis. Every month we have points, we have samples coming in from all the points in Zimbabwe, so that the analysis is done for chemical and microbiological analysis. So side by side to these points, the agency is trying to establish monitoring points for AMR, so that we are also able to monitor let's say the levels of antibiotics that are in the environment, and also the associated resistance. For the moment, we'll be looking at E. coli and Salmonella. So far we have established points in Harare and Bulawayo, and however, the sampling was disturbed by the ongoing COVID-19 pandemic. So really, what we are trying to do is to come up with a baseline of what we have in the environment in terms of antibiotics. What is there? We know that as waste goes into the environment, we have antibiotics that are being flushed into the environment. But what is there? We really don't know. So this is what we're trying to come up with. Because once we have a baseline of what is happening in the environment, then we can be able to establish standards and acceptable limits, so that at the end of the day, we can say this so-and-so pharmaceutical company discharged so much waste into the environment, and from this waste, there was so much, antibiotics, and thereby they are not sticking to the regulations that we would have put across. And this also enhances monitoring of the environment. Next slide. Also, under surveillance, the Environmental Management Agency laboratory participated in the AGISA project, whereby we're also collecting different types of water samples, that is bore, river, and sewage samples, and we were also submitting them to the NMRL, as highlighted by Dr. Manangazira earlier on. The laboratory is also a part of the WHO integrated global surveillance on ESBL producing E. coli. So this is also a tripartite project that is it was really supposed to start, I think, in March, April there, but also disturbed by the pandemic. Next slide. So the most important tool that the agency is using to contain AMR is the legal framework that we have. So the Environmental Management Act is the one that we mainly use. And this one is read with its ancillary legislation, which includes the Statutory Instrument 6 of 2007, which deals with effluent and solid waste disposal. Statutory Instrument 10, which is on hazardous waste management, and also the Waste Management Policy of 2007. Next slide. So these pieces of legislation empower the agency to carry out inspections on different, say, companies, say, different places. And then after carrying out inspections, we can be able to save orders if we find that there's something that is happening that is not in line with the legislation. So we save orders. Orders are really just instructions for whoever was the offender to stop whatever they are doing by a given date, so that they realign their activities to the environmental legislation. So after saving orders, we can issue tickets depending on the on how big the offense is, or we can really take the offenders to court or bring them before the AMR board. This has been happening mainly, say, with local authorities. I know in the past, even Harare local authority has been brought to the AMR board to answer for their disposal of effluent into one of our major rivers. So these are some of the efforts that are being done by the agency in a way to try and contain pollution. And by containing pollution, we are also trying to contain AMR. Next slide. So this is just a picture of what happens when the agency has used its the pieces of legislation to reprimand people. So we have before the intervention of AMR, you see that dump site, and then after intervention, when the local authority had been told to compact the landfill and make sure that all the waste had been disposed of in a manner that is acceptable. Next slide. So the Environmental Management Agency, the Act itself provides for stakeholder participation in environmental management. This has led to the establishment of what we call community-based organizations. These are organizations whose activities align to environmental legislation in terms of recycling, in terms of dealing with waste in the environment. So we have a total of 250 community-based organizations. These are the ones that are registered with AMR. But if we're to look at it, there's way more than that, because we have other organizations which have not been registered with the agency, but that we see that they are also in the business of dealing with waste. So these organizations really promote the three R's principle, that is reduce, reuse, and recycle when it comes to dealing with waste. They are encouraging waste separation at source. So waste separation at source, really, we are saying we're encouraging households to use the 2-bin system, whereby we are saying we have 2 types of bins, the green bag and the black bag. In the green bag, we have the biodegradable waste, and in the black bag, we have all the other waste that cannot be recycled. So when these the CBOs, when they visit the different residential areas, if we have these 2 types of bags in the residential areas, they'll just come along and grab the green bag, because they know that's the bag that is going to, that will have the waste that they're looking for, that they can recycle and come up with useful gadgets that they can actually sell. So these people are really focusing on what we are calling the trash to cash concept, whereby they are converting trash and coming up with useful gadgets, and they are able to sell, and they are making a living out of it. We have pilot projects in Sunningdale, Budiriro, and Bari. Next slide. So this is just a picture of what is coming out. I'm sorry, I think the other picture didn't download well, but the other one is these are just pictures of the recycling that is being done. As you can see in one of those pictures, those are cans that have been crushed together, and they'll then be taken to a recycling center and they'll be recycled, and be better gadgets will be obtained from there for sale. Next slide. Then there's another strategy that we've been using in a way to try and combat AMR and also combating waste management, poor waste management. This is what—
Hello, Tracy.
Yes.
Tracy, sorry. Will you please, 2 more minutes, can you be faster because we are now going over time?
All right, let me try. So we have the Zero Tolerance to Litter campaign. So this was really meant to raise awareness with the aim of instilling environmental stewardship and attitude change amongst our people. This campaign is the one that culminated into the national cleanup campaigns that we're having, and that we just stopped abruptly because of the COVID-19 pandemic, the ones that we are having on a monthly basis, so that we try and minimize the amount of litter that is found in the nationwide. Next slide. Education and awareness is one of our strongest arms also, whereby we are participating in all the programs, education and awareness programs under the One Health program. These include the World Antibiotic Awareness Week, where we are attending radio programs, public lectures, and also newspaper articles. We are also part of the team that is coming up with the communication strategy for Zimbabwe. And we also have environmental clubs at schools and also at community level. Next slide. So really the challenge that we have at the moment is aligning the issues to do with AMR with the current environmental legislation. Like I was talking about the ambient monitoring, whereby we are looking at chemical and microbiological analysis. So we also need to then look at issues to do with residual antibiotics in the environment, the standards to do with that, and the best way that we're going to use that piece of legislation to monitor AMR. And also conventional wastewater treatment plants that we have are really not designed to address AMR. You find that the water will be treated, but still antibiotics will be able to pass through the water system. Next slide. So finally, as the saying goes, prevention is really better than cure. It is best that the discharge of AMR determinants is prevented so that ultimately we're able to control what is going into the environment, and at the end of the day, containing what is in the environment and containing what is coming out of the environment that could possibly harm us. And I think I've come to the end of my presentation, and I thank you for that.
Thank you very much, Tracy, for informative presentation concerning what AMR is actually doing. You talked about the act that AMR actually has. What is it that is actually driving waste within our country, like the high population, the illegal settlements, and also so much waste that is actually being generated is actually increasing. And also what AMR is actually doing, concerning issues on AMR, like the monitoring of AMR, the river waters, the monitoring points that you actually had for other things, but at least you are now including AMR. And also the legal framework that AMR actually has makes it able to act on offenders of issues concerning waste. And also concerning the community-based organizations for separation of waste. So that is actually good. That's which is actually happening. So thank you very much for that informative presentation. Now we go to our question and answer session. There have been some questions that have actually been asked on the chat. Maybe I can start with those before we go on to other people that want to say it loud. somebody called Kenneth Matimaire actually hinted on was asking Dr. Manangazira, saying that there was that high resistance of drugs concerning the cholera outbreak. Did this actually cause deaths, the cholera deaths? And also, he asked, there's currently in Zimbabwe a malaria outbreak. Is it linked to resistance? So these are the two questions that Kenneth has asked. And then the other question that was asked by Munyoro to Tracy, he said, how much is the cost of crushing the cans? So can we have answers to those questions first from Dr. Manangazira? Over to you.
Hello, thank you, and thank you for the questions on the cholera resistance and on the other outbreaks going on, including malaria outbreaks. So yes, we did have significant resistance to the Vibrio cholera, as I said in my presentation. And I apologize, I saw on the chat box that some of the terms were quite technical. I thought I was trying to explain as I went on with my presentation, but my apologies. So yes, we did see quite significant resistance. And we have recently published a paper in the New England Journal of Medicine on our highly resistant cholera strains. It used to be the case that when you see a cholera case who is mildly or moderately dehydrated, you just give them fluids and there was no need for antibiotics. But in the last cholera outbreak, I think a significant proportion of the patients required both the rehydration and the antibiotics. So we would just give antibiotics to the severe cases. But now it may have changed because we have also introduced the oral cholera vaccination. It's not countrywide. It targeted the so-called cholera hotspots. So what we had to do was to look at some of the conditions, and I'm happy my colleague from AMR has really described some of the environmental issues that are leading us into these high numbers of infectious diseases. So we used that those determinants from the environment, but also from the water and hygiene situation to geolocate some hotspots. And that's where we have targeted the oral cholera vaccine. It will be interesting going forward just to see how the resistant patterns shift following the introduction of the cholera vaccine. And also improvements in the water and sanitation and hygiene situation in the country. Now coming to the other outbreaks, and the question was specific to the malaria outbreaks. Yes, we have seen worsening of malaria situation in the country. As a country, we're looking at malaria elimination, but I think there's been challenges in terms of the program itself, but also in terms of the preventative arrangements in terms of the indoor residual spraying, the use of insecticide mosquito nets. I think, and I'm happy my colleague ended up on the note to say prevention is always better than cure. So these are totally preventable diseases, infections and infestations. And the more we work on the preventive side, the better. So I think we are still getting reports of malaria cases as we talk. And perhaps we'll also have another opportunity to discuss when I've gotten details from my colleagues in the malaria program as regards the outbreaks that we've experienced this year from malaria. But as a country, we really are riddled with a number of infectious diseases. Last month and the month before, Bulawayo was battling with 3 outbreaks. of Salmonella typhi, Shigella dysentery, and the coronavirus outbreak. So that's how bad the infections are. And when you look at that and overlay the water and sanitation and hygiene indicators, you can almost tell where the next outbreak is going to happen of the infectious diseases. Thank you. Over to you, Madam Chair.
Thank you very much, Dr. Manangazira, for those well-articulated answers. Tracy, somebody asked how much is the cost of crushing the cans? So please, can you answer that one?
Yeah, okay. Really, I wouldn't say, I would be able to really say how much the cost of crushing the cans is. It really depends on the recycling company that you're dealing with, because we have several recycling companies in Zimbabwe. So if I were, the best, I guess, would be for us to link you up with different recycling companies that we have in Zimbabwe, and then you can tell from the different companies how much it would cost. I guess it also depends on the size of the can and how much of the trash that you're bringing in. Thank you.
Okay, thank you very much. Somebody has asked, how can drug resistance be mitigated by the health sector? So they're asking, how can drug resistance be mitigated by the health sector? Over to you, Dr. Manangazira.
Thank you. So mitigation, yes, but this is why I think we take a whole of society approach, and across the government agencies and the major agencies, we also want the One Health approach. As I said, a lot is really in terms of addressing the determinants, the causes of the causes, as it were. So you want to ensure that you don't need to take the antibiotic in the first place, and when it's taken, am I muted? And when the antibiotic is taken, it's taken properly, not somebody takes it for a day or two, they feel better, then they stop. So there's a lot that happens beyond or outside of the health sector. When it comes to the health sector, that's when we are talking about the rational use to say, are we giving an antibiotic for every sneeze and flu and so on?
I just don't know how much they are charging, but that's way too much.
Hello? So I'm just saying, in terms of the health sector, the mitigation now comes in ensuring that all our professionals, those who are prescribing, are licensed to do so, and they are practicing the rational prescribing, and they are informing the patients exactly what to do and what not to do around the antimicrobials. But the ball is really in the society's court to say, can we stop what we have been doing in terms of abusing these antimicrobials and start using them rationally so that we preserve a number of classes of antimicrobials. Thank you.
Thank you very much, Dr. Manangazira, for those answers. And I would like to come to an end of this particular session, which was highly informative to everybody. And even somebody has commented, I think Rumbidachi Roads, actually thanking the panelists for such informative presentations. They are really, the journalists are really appreciating the informative presentations that were actually done. So I would like to hand over to the next session, because we have gone over with 15 minutes. So because it was really interesting. We now hand over to you, Supano. You can take over now.
Thank you, Dr. Sekasai. Yes, we have gone a little over time, but for the sake of discussions like these, I think we should be a little lenient over there. So I would like to now welcome everybody to the next session, which is media perceptions on AMR. To begin with, can I request Sukanya, who is the person behind the scenes over here, to actually allow all the participants to come online as panelists, basically, so that we can see them. Yeah, thank you. So while she is doing it, I will continue. I do not want to lose much time. We have 3 speakers. I can see that all of them are here. We have Mr. Stephen Matenga, my friend, who is the Secretary General of the National Association of Freelance Journalists in Zimbabwe. We have who's going to talk about issues and expectations of media in reporting on AMR. We have Dr. Tapiwana Sheikh Uhinga, the chairperson of Zimbabwe AMR Core Working Group, Education and Awareness, and who's going to talk about the importance of engaging media to contain AMR. And we have our 3rd session, which is media engagement as part of NAP implementations, essentially a set of perspectives from Zambia, which is going to be, the presentation is going to come from our 3rd speaker, Ms. Otrida Kapona, lab scientist, communicable diseases and AMR national focal point and coordinator from Zambia. Before I hand over the mic to our first speaker, Stephen, let me just put in a couple of words here. AMR is a global issue, but in the global south, what we have perceived it is that the challenges and issues are similar. So, we sitting in India and you are there in Africa. For us, it's yesterday also we talked about it. For us, the challenges and the issues and the problems are somewhat similar. It's an opportunity, this workshop, it gives us an opportunity to listen to some excellent experts. We have spent the last day and then some part of today talking about these issues, and also to network with them. And this particular session is very specific to media perceptions. So I'll be requesting and I'll be expecting all the participants, all the people here who are attending, to please do sort of put in questions, do make suggestions, recount their experiences once we are done with the speakers who are presenting. Okay, can I now hand over the mic to Stephen, please? Stephen Matenga, Secretary General, NAFJ. Stephen? Stephen, are you there? Okay, there seems to be some issue with Stephen's network. Can I ask Dr. Kuinga to take over? Hello? Dr. Kuinga, would you take over, please? Can we begin with your presentation?
Yes, thank you. I would be happy to do that. Good morning, everybody. Oh, it's now good afternoon here. I would have been happy to present after Stephen, because I would have simply built onto his presentation. But let me start by sharing my screen just a minute. I don't know why it's not coming up. Okay, so thank you. So thank you, Sipano. And my presentation is talking on the importance of engaging the media on reporting on AMR. And I wanted to speak after Stephen so that I can address some of the issues which would have come up from his presentation. But I will try and anticipate, some of the issues pertaining to the media in reporting on AMR. As Dr. Banerjee said, I'm the chairperson of the Education and Awareness Technical Working Group within the National AMR program. And part of our mandate is to disseminate information on antimicrobial resistance to stakeholders and to the general community so that people are aware of antimicrobial resistance, its transmission and spread, as well as the methods of preventing its spread. So by way of background, the issue of AMR is not new. I'm sure, from yesterday to today, you've now learned, of the background of antimicrobial resistance. But what happened over the years is that, the World Health Assembly, after looking at the evidence that was coming in from as way back as 1959, started, reacting through the WHO. The World Health Assembly is the governing body of the World Health Organization. And they came up with several guidelines, but also resolutions during the May annual meetings. And in May 1998, there was a resolution which noted that AMR was increasingly hampering treatment of infectious diseases. And it rendered some antibiotics totally ineffective. And it also drove up the cost of treatment through new generation agents, and then urged the member states, among other things, to develop educational programs for professional staff and the general public to encourage the appropriate and cost-effective use of antimicrobial agents. So this speaks to information dissemination. And in May 2005, again, they noted that despite progress, the strategy for containment of AMR has not been widely implemented. And it urged member states, among other actions, to provide support for gathering and sharing of evidence on cost-effective interventions for prevention and control of AMR at national and local levels. So this again spoke to information dissemination. And then in 2015, the global body came up with the AMR Global Action Plan, which kind of like set the standards for national action plans on AMR. And I'm sure that there's been some presentation on our national action plan. So we took the blueprint from the global action plan, including on education and awareness on AMR. So the global action plan proposes a whole of society approach to AMR. And this is part of what Dr. Manangazira was talking about, because everybody needs to know about AMR. So when we, for example, look at the COVID-19 pandemic, you have to be living under a rock not to know about COVID, because it's everywhere. Wherever you go, there's issues of COVID being discussed, either on the radio, on television, in the newspapers, word of mouth, and so forth. People are talking about COVID. And we need the same approach to antimicrobial resistance. So the plan states that AMR will affect everybody, just like what COVID has done. When COVID started, I think some people were thinking that they were safe, especially people who live in the glass towers. They thought they were safe. But COVID is so highly transmissible, and the same is true of AMR. So the Global Action Plan, they noted that whoever you are, regardless of where you live, your health, economic circumstances, lifestyle, behavior, you will be affected. And it will affect sectors beyond human health, such as animal health, agriculture, food security, and economic development. So it's not just a health condition. It goes beyond health. It goes to economy, it goes to agriculture, and it goes to food security. And so the Global Action Plan suggested that, everybody in all sectors and disciplines should be engaged in the implementation of the action plan, and in particular in efforts to preserve the effectiveness of antimicrobial medicines through conservation and stewardship programs. So this is important as a background, so that, as the media fraternity, as the fourth estate, you are aware of, where your sector resides within the AMR response. So in 2017, we then had the finalization and approval of the AMR National Action Plan. And it recognizes the fact that AMR affects every person, regardless of color, religion, location, social standing, respect for persons. It's important that every person in Zimbabwe is reached with accurate and relevant information on AMR, and prevention methods. So there are 5 pillars within the Global Action Plan, which we have also adopted within our national, which starts with education and awareness, laboratory surveillance, and infection prevention, control, security. So of all these 5, the center of the national response, because common understanding that all the sectors must actually be aware of sensitized on AMR to enable them to respond. Doctors, pharmacists who already know about AMR, but they must, so that they are able to take appropriate actions. So it was then proposed that
Is Dr. Kuhinga audible to people? No.
No,
I think we have lost him.
Yeah,
I think there's some connectivity issue over there, which Stephen is also facing. Can I request all the participants to please mute their microphones? Can I request all those participants who haven't already muted their microphones to please mute them so that the speakers aren't disturbed? Thank you. Dr. Kuhinga, can you hear us? Planet Earth to Dr. Kuhinga. Okay, nothing. I think we have lost him. Okay. Stephen, do you want to take over now? Stephen?
I don't think his audio is working yet. So maybe
I see.
Go ahead with Utrida.
Okay, okay. Let's let Stephen work on his audio and then get back to us. Utrida, are you there? Utrida is there, but she's on mute. Stephen, what Sukanya is suggesting is, can you please try to sign out and then sign in back again? Yeah, can you, Stephen, can you please sign out and sign in back again? Right. Utrida, can I, hello, Utrida? Okay. Utrida is also unavailable at the moment.
Hello.
Okay, okay, she's there. Oh, lovely. Hi, happy to have you back. We seem to be having a lot of network problems with our speakers. So my apologies to all participants. Can I request you, Utrida, to take the mic in the meantime? By the time Stephen comes back, maybe you could take the chair and continue with your presentation.
No problem, sure.
Thank you, ma'am. Utrida will be talking on media engagement as part of the NAP implementation.
Thank you very much. Good morning. Good afternoon. Everyone, I've already been introduced. I'm Kapona Ochida. I'm the National Focal Point and Coordinator for AMR in Zambia. Rajeshwari, can we do PowerPoint?
Can you not see my screen, Uchida? I've already done it.
I can see it, but you haven't activated PowerPoint.
Just do it again. Is it okay?
Yes, thank you very much. We can go to the next slide, please. I'd like to begin my presentation. First, a big thank you to CSC and Zimbabwe. Congratulations, Zimbabwe, for engaging the media in this regard and for organizing this workshop. Thank you for reaching out to me to share the Zambian experience. I'd like to begin my presentation with this picture that basically explains the concept of the One Health approach. We keep hearing how that AMR is cross-cutting. Human health, animal health, the environment, agriculture. And I think this picture clearly depicts what we're talking about. Antimicrobials are used across sectors and ultimately they end up in the environment. In the recent past, there has been an advancement and interest in aquaculture. And we realize that even in aquaculture, there's some antimicrobials that are used there. And so everything that is used in the human health sector, in the animal health sector, some pesticides that we spray on our plants, all of it ultimately, because the environment is what houses everything, ends up in the environment, and what's in the environment human beings and to animals and to plants, and the cycle continues. Next slide. So what is our response as a country to AMR? We joined most of the other countries in the global community, and we threw a consultative process of aligned ministries and cooperating partners, developed a 10-year plan with objectives drawn from the Global Action Plan. The 5 objectives: awareness, improvement and understanding through good governance, effective communication and training. Objective number 2 focuses on being able to generate data to inform policy and action. The third one is reducing the incidence of infection, sanitation, hygiene, and biosecurity. Number 4 focuses on optimization of antimicrobial use across the sectors. And the last one is investment in research and in development. I have highlighted raising awareness as because this is what we are looking at today. Next slide, please. Now, what are Zambia's efforts since we launched our National Action Plan in November? What has been our effort towards media engagement? So recognizing the important role that the media plays in information dissemination, we have organized 2 different orientations for our colleagues in the media. And this was to help them better understand the topic at hand, and using their experience and expertise, see how best they can help us package this information for the general public. We've also had 2 training workshops done. These have not been specific to AMR, but there's been some component of AMR. Our focus on this has been public health reporting, because we want our colleagues in the media profession to begin to have interest in reporting on public health that affects our communities and our societies. rather than focusing on politics and other things that people might consider interesting. Additionally, we've had live television and radio programs and discussions since 2017. So these have been ongoing programs. And because of the relationship we have built with the media, we are lucky that the Antimicrobial Resistance Coordinating Committee now can get free airtime on TV and on radio to discuss matters relating to antimicrobial resistance. So we've had TV and radio programs. There are sometimes phone-in programs where the community calls in to ask questions, and they are moderated and facilitated by our colleagues whom we have trained from the media. Last year, we decided to do something different. We introduced what we are calling the AMR Media Awards. So the AMR Coordinating Committee last year partnered with MISA, that's the Media Institute for Southern Africa, the Zambian chapter. It's like a body that oversees and sort of coordinates all media professionals. So we partnered with them and introduced the AMR Media Awards. And these are basically to encourage our colleagues in the media professional to recognize those ones that have been spearheading reporting on AMR and public health reporting. We will have the second round of awards on the 23rd of September this year. And we hope that this is an initiative that we can sustain going forward, as we have seen that it has encouraged more publications, more reporting, and more interest and engagement by our colleagues in the media. We have also planned additional workshops that we should have started to do earlier in May, but because of the pandemic, we couldn't have. So we're trying to see how best we can salvage the remaining of the year to do additional workshops. And this time around, we want to also include editors, because we realize that sometimes the reporters, most often than not, they're not the ones that make the final decision, especially for print, TV, and radio, as to what should be aired, as to what should be printed. So we want to be able to engage the editors and also the heads of these institutions so that they also have an understanding and make their contribution towards what we're talking about. Next slide, please. So these are just some of the pictures that I have put from our media orientation and our training workshops. The next one. The TV and radio programs that I was talking about. Next slide. And the AMR Media Awards that we had last year. Next slide. So the progress that we have seen following the trainings and the orientations, we can see that we have some reporters and journalists that have now started reporting on AMR since 2017, whether it's online, print, and all. Next slide, please. And the next one. Now, why? Why are we talking about the media? Why is engaging the media important? So we have recognized that the media is a key partner in information dissemination. One of the documented major drivers of AMR, like we are told, is misuse and overuse of antimicrobials. And you agree with me that as much as we have lived with multi-drug resistant TB and these other common resistances, the concept of antimicrobial resistance itself is relatively new. People do not have an understanding. As much as they know certain people will not respond to these medications, they don't really know what this AMR is. And so we believe for people to know, they need to be told what the problem is and what their role is in addressing the problem. And so we have recognized the media as a strategic partner in being able to disseminate this information. They are public influencers. I will give an example of the ongoing of COVID outbreak. You will have people from the different ministries giving them information, and they would be a bit skeptical about it. They'll think you're withholding certain information and all that. But whatever our colleagues in the media professional report, people seem to agree with them more. And so it is important that we get to bring them on board to raise this awareness and facilitate for awareness creation, and hopefully eventually trigger behavior change that you agree with me is very, very difficult to attain. We also hope that this raising of awareness through the engagement of the media will significantly contribute to then promoting the judicious use of this very precious resource, and then reduce the development and the spread of antimicrobial resistance. You will agree with me that when it comes to the way we use our antimicrobials, there is an urgent need to change in that regard. Because even if we were to have some discoveries of new classes of antimicrobials today that will be working, for as long as we don't safeguard them, for as long as we don't change the way we use them, we will still be in this dilemma. Even those discovered antimicrobials will still lose their effectiveness at some point. So if we are to achieve that change of behavior, there is need to reach out and raise awareness, and who better to help raise awareness than our colleagues in the media profession. Next slide. So in my conclusion, I will leave you with this quote by William Benbeck. He says, all of us who professionally use the media are shapers of society, and I couldn't agree more. We can vulgarize that society, we can brutalize it, or we can choose to do the exact opposite, lift it into higher levels. And so I hope that our colleagues in the media who are influencers and users of the media of this will take this opportunity and use the media to raise awareness in society, so that each and every one of us, for the very simple fact that in our lives, at one point in time, we use antimicrobials as individuals, we'll be able to learn what our individual responsibility is towards safeguarding the effectiveness of this very precious shared resource. Thank you very much for listening.
Thank you, Trida. Very, very pertinent. You know, I particularly like the point that you made, that people seem to agree more with media. That is exactly the thing that we also experience here in India. May I now request Stephen, who's back with us, to take the mic. Stephen? Stephen, are you able to manage your audio now? Stephen? There seems to be a problem again with Stephen's audio reception. Dr. Kuhinga, would you like to continue what you were talking about? We had lost you for a short while over there.
Yes, thank you. Can you hear me now?
Yes, yes, you're audible.
Hello?
Yes, you're audible, Dr. Kuhinga.
Thank you. Yes, my apologies for my network just fell when I was venting. So I just finished talking about our national plan and the focus and awareness being at the center. So this is the cover. It is online. so we can send out links to all those who want to download it. It is a very comprehensive document, and it tells you what you plan to do between 2017 and 2022. So I just want to then go back to the role of journalists in creating awareness, on diseases and pandemics. And it is really clear that, the awareness on pandemics has traditionally been raised through the media. So when you go back to HIV, for example, the first reported cases were in the what is called the Morbidity and Mortality Weekly Report, 5th of June, and that's a historic day, because that was the first day when it was reported that there were some young gay men in New York and San Francisco who could not be treated despite the strongest antibiotics being used. But because there were so many other young gay men who were sick elsewhere, the press picked up the story, and then it went through the world, and we got to know about HIV even before it hit Africa. But the same also happened when triple therapy became widely used from 1996. It was reported in the press, and that actually gave rise to treatment advocacy and people pushing for universal access to antiretroviral therapy, and that has now happened. But the press was actually the catalyst. And so, but there are some pandemics which never reached Zimbabwe, but were widely reported in the local media. So we've got the West African Ebola outbreak, for example. We've got the Zika virus pandemic, and we've got the SARS pandemics. These were widely reported. They never got to Zimbabwe, but we got to know about them through the local media. And then, we also got to know about the outbreak of the COVID-19 pandemic even before a single case was reported. So there was a lot of anxiety and apprehension even before we got to know of anybody who was infected. So it shows you the power of the media, and I mean, the members of the media who are here are aware of it. So media coverage helps the public to be aware of newer emerging diseases, their transmission and mode of treatment. And this helps then people to take action. So when it comes to AMR, what is the challenge? So AMR, as you may know by now, is not a disease. It doesn't manifest in physical symptoms. So when you get HIV, for example, a person infected with HIV will show symptoms. A person infected with COVID-19 might show symptoms. A lot of people are asymptomatic, but some, exhibit symptoms, So people will know that, I've got this disease. But with AMR, there's no symptom. And it can only be detected through a laboratory test. So somebody asked, with malaria, are we getting resistance? There is resistance which has developed to the commonly used artemisinin in combination therapies, which we are using in Zimbabwe. But until and unless a person is tested, it is impossible to know that they are resistant to that therapy. And in Zimbabwe in particular, these tests, to test for antimicrobial sensitivity are not routinely done. So people who may have developed resistance may not even know that, the pathogens within their bodies have developed resistance. And of course, I mean, people who may have developed resistance may eventually die from that condition they are suffering from. And until and unless they are, tested for sensitivity, it may not be known, what caused the medicines not to work. And the other thing is that AMR has got so many routes of transmission, and it is impossible to determine, its transmission routes or, how it came to be on a particular person. And there's also a strong link between animal health and human health, which makes it difficult to determine the source of particular resistant strains. I mean, for COVID-19, for example, that's another strain of AMR, for example, you know, because all the available therapies to that particular strain of virus, the coronavirus, are not working. So there is an element of resistance. But there is the theory that it evolved from bats, you know, and then it came into human beings. So there's a lot of links that we share with animals in terms of disease transmission. And the other thing that is also evident is that the concept of AMR is difficult to communicate to the general public because, I mean, you know, somebody was saying, can you break down the terms, you know, on this call? So you can imagine how difficult it is to explain AMR to communities, you know, whose indigenous languages do not carry the terms that we are trying to communicate. So yeah, so these are some of the things that, you know, we've noted within our education and awareness efforts. But here's the challenge. AMR is actually killing a lot of people. It's affecting a lot of people. It's costing a lot of money. In America, in the USA, more than 2.8 million antibiotic-resistant infections occur annually, and more than 35,000 people die as a result. In Europe, you've got between 33,000 and 37,000 deaths, depending on which publication you believe. Between 33,000 and 37,000 people die annually, and it's costing about 1.5 annually in healthcare costs and lost production. So the Jim O'Neill report, which has been mentioned here, states that by 2050, AMR will be responsible for 10 million deaths annually if left unchecked. So that means for Zimbabwe, we just need 2 years and everybody's wiped out. And then it will also cost the economy, global economy, up to $100 trillion. So in Zimbabwe, for example, and other low resource settings, there is no comprehensive data in terms of prevalence, but it's showing that we have a problem. But looking at all these developments, there's very little awareness of AMR at all levels. So the general public do not know about AMR, farmers, agriculturalists, policymakers, patients, and our journalist fraternity. There's very little awareness of AMR. And because AMR is not as aggressive as some diseases, and we've got so many competing health priorities, you know, we've got TB, HIV, malaria, we've got, you know, maternal and gynecological conditions, non-communicable diseases, cancers, and so forth. AMR seems distant and then threatening because we don't see it, but it's actually a huge ticking bomb. It's even more serious than cancer. It's more serious than HIV. It's more serious than any other pandemic that we've even, you know, that we've seen. So this is a snapshot of the AMR impact, and you know, that has been referred to previously. So what should be done? So we need awareness of AMR and its potential threats to national and global public health at all levels. It must reach people, or everybody, just like what has been done with COVID-19 awareness. So at the moment, the Education and Awareness Technical Working Group is working on the National AMR Communication and Awareness Strategy, which Tracy referred to, and it proposes to develop appropriate messages and disseminate accurate information on AMR to diverse populations. And so it would be important that messages on AMR are widely disseminated in Zimbabwe using all forms of media, whatever it is, and I've just put a few here. And in order to do that, we need journalists, right? Journalists have got access to the mass media. Journalists know how to frame stories. Journalists know how to communicate to their reading public, and journalists have got the know-how, you've got the skills. And that's why your role is important in AMR. And Otrida has referred to that. So we've previously engaged with journalists especially through the ZAT initiative. And it is important that we re-engage and start moving forward, especially with where we are right now. Once we come up with a framework for collaboration, we should be able to sustain it. And I think one of the things that we need to do going forward is then to have a collaboration through the finalization of the strategy, so that we can then place the media where it's supposed to be, but also maybe create a desk for the media to bounce ideas off and get ideas, so that some of the issues pertaining to AMR can easily be broken down into language that journalists can understand and then report on it. This picture is maybe Dr. Manangazra has shared it before. This is Dr. Zinywera giving an award. I think that's Shamiso Nico. That was the ZAT award presentation ceremony at the Jamestown. And if you go through the internet, you can see, some efforts now being done to engage journalists in reporting on AMR. So this was an article by Monica Jeff-Pere, the role of journalism on YouTube, audience engagement with superbug reporting. So superbugs is another word for antimicrobial resistance. And this is actually in Malawi. I'm sorry about that. This is Malawi. The role of the media in the fight against antibiotic resistance, antibiotic awareness week in 2019. And this is a clip from REACT, Successful Antimicrobial Resistance Media Training in Kenya. So there's efforts to engage the media to ensure that the media can then report on AMR using its its capacity to reach millions of people with messages. So thank you very much for listening, and I apologize once again for the glitch. And over to you, Sugano.
Thank you so much, Dr. Kuinga. Thank you. I can see that organizations and agencies in Africa are doing a lot to what you have referred to, to generate awareness about this ticking bomb. Now, can I now request Stephen, who's been waiting in the wings, to take over, and then we can open the floor for a few questions. We don't have very much time. Stephen, can you please take the mic and perhaps try and make your presentation in 10 to 12 minutes. Stephen, we can't hear you. Stephen? Stephen, your audio is not working. We cannot hear you. Stephen, your audio is not working. We have gone back to sign language. My apologies to the participants and our other panelists. We cannot hear Stephen. Some problem with his audio.
And now?
Yes. Stephen,
you can hear me now.
Yes, yes, yes.
Yes, you can hear
Thank
me now.
Yes.
Okay, okay. Thank you very much. Let me. Okay, I'll be very brief with my presentation. Basically, we've realized that AMR can be the next pandemic following COVID if we don't take action. The technical experts have already shown to us that AMR is a threat to global health and to humanity. So my colleagues like also like what Dr. Kuchinga has just said. So it is very clear that there is need for creating awareness of the threat that AMR is to global health and to causing to humanity. So and as an association, the National Association of Freelance Journalists, we've come on board to say, no, how best can we participate in this process of creating awareness? So the best thing is we need to inform our public. So it is also very clear about the threat that AMR is causing for us and us to be able to communicate effectively to the public. We first need to give this skill or the information or the awareness to journalists to break down the technical terms, to break down everything so that how best can we participate in this process of creating awareness. So the best are more likely to inform the public accurately. So basically my presentation is about ways in which journalists and or messages that are for public consumption. So I will basically go straight to those points. One of the things that he can do is to give us as journalists content, but we are not aware of those events. We are not aware of those researches. So it is very important to give journalists those researches information. I think one way we can do this is maybe to start a WhatsApp group so that we start sharing information in that platform, and also the organizations that are working in the field of AMR, such as OIE, CSE, and so forth.
Stephen, excuse me, your voice is breaking. So can you shut down your video and just continue talking, please? Can you continue your speech? Yes. There is no clarity, Stephen.
Kindly let us know of such publications so that we sorry. Okay. So yes, we need to know of such publications like the example that was given by OIE, dedicated society on AMR. Then also there's a concept of mentorship, where maybe in animal science or in crop science. So when the journalist produces an article, they first share it with the technical expert. The technical expert gives his or her own contribution and also correct some terms so that the article becomes very accurate and also is simplified to the extent that the public can understand. Because as you know, AMR is a complex.
Stephen, which slide are we on? Stephen, excuse me, which slide are we on?
Yes. The one
which
that
slide?
Was
slide number?
Awards.
Which slide are we on, Stephen? I wanted to ask you.
On number 6. Number 6.
Number?
On number 6. Number 6.
Number 6. Number 6. Okay.
Yes.
Number 6. Yes. Thank you. Okay.
Yes.
Yes, please continue. Sorry.
Okay, so you'll be okay. So I am also happy that Otrida talked about awards as an incentive and also as compensation for the work done by journalists. The awards can be monthly, the awards can be annually, and also they can be for different categories. Like, okay, we have awards for AMR related to animal or to human or to crop. And also they can be for different platforms. We can have awards for those writing for the internet, awards for those writing for the print media, and also for the radio or TV. So awards are an incentive, but also a recognition of the work that the journalists are carrying on. Can we move to the next slide? So we can also come up with a strategy of commissioning stories. You see, journalists have space to publish maybe through their publications or at work and so forth. But sometimes, because AMR is not a topic that is popular, because AMR is a complex and unpopular topic so far, there is need to also invest in the cost related to bringing such stories. This costs, for example, the internet, making calls, find out exactly what's happening in the field, and also maybe equipment hire. So we encourage our partners to assist with meeting such costs so that if it is like AMR related to animal, we can go to the farms, we can go to the field to find out exactly what is happening. So there's need to. This training is a first training for us as the National Association of Journalists. But I understand the Ministry of Health, journalists, especially the Health Journalists Association of Zimbabwe. But there is also need to have more and more of this training. In the run-up to this training, we had a lot of people, journalists interested in the training, but we could not accommodate. I think there is need to invest in more and more trainings. The next slide is also about a regional focus of our media engagement. We can either do country by country, like what we've done here. There's an effort in Zambia, but we can also come up with a regional platform, collaboratively or collectively at regional level, at SADC level. And on behalf of the National Association of Freelance Journalists, I think we can pledge to coordinate this process if supported by our partners at regional level, because the experience that we have got in mobilizing for this workshop can also be of use at the regional level. Next slide. What we can also do as journalists in the effort to create awareness of AMR is to bring, to produce resources which are basically to guide the journalists. For example, the definition of terms. We can come up with a tool with terms that are commonly used in AMR, so that those terms are defined and simplified. We can also consider coming up with a tool, which is a guideline on ethical, come up with a reporter's guide on reporting AMR, whereby we put a lot of facts about AMR, the issues, the topics, the debates, the events, and also a director of contacts, who to conduct in which organization and in which country. If I want to write a story about AMR on animal health, who do I contact the Department of Veterinary Sciences? What are their contact details? In Zambia, who do I contact? In Botswana, who do I contact? So that it becomes easy to get information. And also efforts to try and simplify or the topic, because it will be very difficult for the general public to understand if the language is too technical. So there's a need to simplify the language to make it easily understood by the general public.
Your voice is breaking, Stephen.
And next slide. Okay, which slide are you on? Hello?
Yes, Stephen.
So in conclusion, we hope that journalists have gained, yes. In conclusion, we hope that journalists have gained insights into the issues related to AMR. And like we have said, this is a start. It's not the end in its own. This is a starting point. We hope that we will get further engagement with our partners and also through training and other interactions. But we now encourage the journalists who are participants in this process to create awareness in their communities, to start creating awareness. This workshop has probably helped us to come up with angles on how to explain or to express the topic to the public. So we need to start writing, we need to start producing content, videos, TV, radio, to create awareness and work with our partners. As an association with an upcoming website, we hope that it will be functional in early September. And we've dedicated a section where we cover issues related to health, and we are going to prominently mainstream issues related to AMR. So journalists can also make use of our platform and contribute stories. So we encourage our partners, Ministry of Health, CSE, international organizations, and also other journalist associations to work with us.
I think we lost Stephen over there. Stephen? Yeah, your video, your audio is breaking.
Yes.
Stephen? Okay, Deepak, can you close Stephen's screen, please? Thank you. Thank you. Stephen, can you hear me? Okay, I think we are back with the network problem. Thank you, all the three speakers, for putting a lot of important information in perspective with respect to the media. Can I now request some of the people here? I don't see very many questions over here, but many of you who are attending would have covered AMR or different kinds of would have covered different kinds of health stories in your careers. Is there anybody here who would like to put in a comment, speak? Anybody who would like to sort of speak out? Anyone?
Chair.
Yes, Wilson?
From OIE. I would like to take the opportunity and thank everybody that have been speaking. It's been really interesting to listen in today. And I think what still is a little bit outstanding, I think, from, and we should all think about, is a little bit, how can we better raise the awareness? Because as has been mentioned in the 2 days, it is a silent pandemic. It's a silent killer. It is difficult to raise the awareness compared to other pandemics like COVID-19. We have discussed all kinds of different epidemics, pandemics that have been throughout the world in many or in recent years, killing people, but still maybe on level with what we see every year in AMR. So how can we really make people more aware of the seriousness of this issue? And this is still a little bit outstanding, I think. I mean, if you look at the COVID-19 now, you see how we daily see how many die from COVID-19. We don't see these figures, and nobody kind of believes that these figures, or don't know that these figures are out there actually. So how can we make sure that we convey the message, and so people try to start to understand how important it is, how big an issue it is. It is a little bit, I think I've said it before, it is a little bit like the climate change. Some years back, nobody was actually listening to the scientists about climate change. This changed suddenly. This change we need to get for AMR. Otherwise, it will be too late. So, but I mean, really interesting to listen into everybody speaking today and yesterday. Also, the importance of the environment. I think it is really, really important to get also the focus on the environment. And as has been said, environment is maybe the key to everything. But thank you very much, all of you.
Thank you so much, Wilson. I think, what you were saying is kind of connecting to what Dr. Kuhinga was talking about, the fact that there are concepts which are very difficult to communicate, and AMR probably is one of them. And the parallels between AMR and COVID actually are not that strong in that respect, because COVID as a pandemic and as something which is happening is visually there in our faces most of the time, while AMR probably is not there. But I am very encouraged by some of these things that I just learned, especially things like the AMR Media Awards, which I wish and I hope that somebody in India would also try and emulate. It's a very encouraging sign. Anybody from among the journalist fraternity who's attending who would like to put in a few words?
Okay, hi.
Yeah, Fitzgerald.
Yes, I wanted to address the issue that okay, that the previous speaker was speaking about. I think it is important, first of all, especially in our nations, that we try to mainstream these issues so that especially, and try to engage our governments so that they can craft policies which can be introduced as grassroots levels, so that when eventually the AMR issues become mainstream, we would have a policy in place that can work to counteract the effects, probably even as on a regional level, as Southern Africa, as Zambia, as Zimbabwe, and the other various nations. We can try to engage each other and come up with even a regional policy if that is possible. So I guess, yeah, that's one of the issues that we can do, and especially even in media organizations, we can try to expand the help desk to make it bigger and cover more spaces in media spaces rather, because right now it is a marginalized field of display. It is too specialized. It's not as mainstream as it is supposed to be. Yet day in and day out, we are affected by health issues. So I think the issue of mainstreaming, it has to do with policy. Policy crafting and policy implementation is very, very important. And also in media circles, we have to make it a topical issue. Health has to be a very, very, very big topical issue. Yeah, that's how I see it. Thank you.
Thank you, Fitzgerald. This is a perfect platform to sort of take this forward, because we have people, we have our distinguished experts from the government, as well as, we have representatives and people representing the media fraternity over here. I believe this is a dialogue that can be continued further. And let me now, if there are any more suggestions or any questions or any comments that anybody wants to make, please do speak up. Otherwise, what I can do is now request my colleague Amit Khurana to come and offer his closing remarks, because we are a little ahead of our time, as I can see. Amit, would you like to take the stage now?
Yes, thank you very much, Suparno. Thank you very much for this very interesting discussion that we just had on the media perceptions on AMR. So closing a 2-day session on such a complex topic at such a platform is always a difficult task. I hope many would agree with me. I'll try my best here. Clearly, the very first thing here is about which I would like to highlight as well as congratulate all of us. I think in the COVID times, in the new normal, this online way of doing workshop, we have been able to pull it well. There, of course, are certain learnings, some glitches here and there, but the fact that at almost very limited cost and limited, I would say, energy compared to a physical 2-day workshop that we would do, and effort that we would spend to have about 20 speakers from all across different parts of Africa as well as world, getting together to talk about different issues from basic science to politics, give a lot of context on the history, give a lot of context on how we can move ahead. So I think that keeping these things in mind, I clearly see we have pulled it well, and I would like to congratulate all of us. Coming to the topics and let's say the speakers and the discussions that we have had. I mean, clearly, as I said, we could gather we could share with our media colleagues, and I'm sure our media colleagues would agree that they were able to figure out what is happening on AMR across the world, what is happening at the regional level, what is happening at the country level in Zimbabwe. What is the history, as I said, what are the efforts, and what are the future strategies and as well as plans. We also, I would also like to acknowledge the introductory remarks by the guest of honor, Dr. Nika, who basically gave a very inspiring speech and essentially gave a sense that yes, it is tough. All of us have to come together. Some things have done and a lot needs to be done. So with that kind of broad sense, I think that set a very good stage for the two days discussion. The overall structure of 2 days was actually divided into one part as content about science, about AMR, about policy, and the other was, of course, we had 2 sessions. The other big component was about role of media. On day 1, we heard our colleagues from India, from Down to Earth. We also heard colleagues from South Africa. On day 2, we heard the perceptions about colleagues from Zambia, as well as Zimbabwe. So clearly, very, very interesting insights that came out of these 2 sessions, essentially. And as we all know, the key messages are, yes, media is a key stakeholder. Media is a public influencer. The fact that media can shape the opinion of the governments and can act as a bridge between the people and the policy is something that is very well recognized. And therefore, I think even in that context, we have been able to pull a lot of ground, cover a lot of ground. And I must say that I can, in a way, I can vouch from all our partners who have organized this, that yes, we have been able to share our perspective in a fairly coherent manner to our media colleagues, and our media colleagues would have benefited well. So what are the key messages in these 2 days of discussions? One, of course, is it's a global problem. It is not really about one country. It is about each and every country in this world. AMR knows no boundaries. The other key message is it's a One Health issue. It is not only about human health, it is about animal health, and the fact that environment, which is otherwise a neglected agenda, now needs to be give due attention. It's really a One Health issue that we all know, but now One Health is no longer on paper. It has to come into action now. An important message that I picked up yesterday was that it is everybody's business, and we all just have to ensure that it remains everybody's business. It does not become nobody's business. It's not about government, and it's about multi-stakeholders. It is about industry, it is about civil society, it is about academia, it is about community at large. But most importantly, it is truly a multi-stakeholder when the media comes into picture. And here again, I think this workshop has helped us to really engage us with the media colleagues, who in my view would complete the overall scenario, overall picture of the stakeholder groups that are there. Because typically media is left out. The kind of workshops more often we go or we organize, media is typically not involved as much as we would like them to be. But this specifically targeted workshop for the media colleagues have filled that gap in my view. So I now see clearly, I can really see media is part of the overall stakeholder group. So in that sense, yes, another message, it is multi-sectoral, multi-stakeholder, but only if media is engaged, media is involved well. The other key message is that the importance of communication. It is very much linked to the role of media. I mean, Walson just mentioned it's a complex issue. Dr. Kuinga just mentioned it's a complex issue. Suporno highlighted it's a complex issue. It is very, very complex issue, we all know, and the success will lie in how successfully or effectively media will simplify these messages for the public at large. Because here again, media acts as a bridge between people and the policy. And the fact that science and the scientific community is engaging with media to inform them well is in my view, is a right and the perfect way to handle this, because it's a complex subject. So clearly, importance of communication, as we said. The other message is of course, AMR is a chronic and silent pandemic. And therefore, here again, the fact that we cannot, the role of media is again very much higher, because you have to be continuous, you have to be consistent with the communication. It cannot no longer be an affair of antimicrobial awareness week. It has to be a much persistent hammering of the issue, much persistent communication of the messages to the people. So clearly, it has to be all year through engagement from the media and with the media. My last point would be about thanking everyone. And I will begin with Ministry of Child and Healthcare, Ministry of Health and Childcare Zimbabwe, particularly Dr. Sekesai Zenwera, Dr. Kuinga, who is in charge of creating the awareness and the education group in Zimbabwe. Then I would also like to thank our colleagues from National Association of Freelance Journalists Zimbabwe, Stephen in particular, and of course, Lucadia, who was here with us yesterday. Very importantly, the media colleagues and the journalists and the reporters from Zimbabwe. I think without you, this would have not been a great success. I do think we could have engaged much more, but this is a learning. Maybe the next time we will have a much more engaging platform, and we'll have more questions, and we'll have more time to answer those questions. So a big thank you from all of us to the media colleagues and journalists and reporters from Zimbabwe. And lastly, my thanks, big thanks to the CSC media and outreach team led by Suporno and of course Sukanya, who's there, and of course my own team, the Food Safety and Toxins team, which is essentially about Rajeshwari and Deepak and myself. So with that, I thank you all. I promise you we'll follow it up well in terms of putting up the right information. You can actually access the information, the agenda, the presentations, and of course we'll try and answer some of the unanswered questions and put them on our website. We have also requested our colleagues, the partners, to put it on their website. So in the next coming few days, we'll be able to do that. With that, I thank you, thank everyone. Over to you, Suporno.
Thank you, Amit. It was lovely 2 days of interactions with experts. As somebody who has been involved with talking to the media for some years, largely Indian media, but in the past few years, I have also interacted very much with African media through various associations. It has been a real honor and pleasure to have interacted with all of you. Some of you in the audience today, I have been in touch with earlier also, people like Andrew Mambondiani, Busani Bafana, there is Wallace over here, whom we have been in touch with earlier as well. And it's a real honor and a pleasure to be here with you. And thank you so much for finding the time to be with us. I hope that we'll continue these interactions where we can bring in more experts, we can bring in more media people to talk to each other.